Finding an effective treatment for pain can be extremely challenging, but there are long-term treatments that work without major surgery or opioids. With us now, Dr. Noman Azim from the Florida Spine and Pain Specialist, and one of his patients, Harriet Patola, with more on this. Nice to have you both here. And Harriet, I know that you were in a lot of pain not too long ago, about 6 months ago. Doctor, why did Harriet come to see you?
So Harriet was having pain from a spinal stenosis. She was having pain.
What is that?
So spinal stenosis essentially is a narrowing of the spinal canal due to decades of wear and tear in the spine. When the spinal canal narrows, it actually compresses nerves. And so what patients will feel is when they're standing for extended periods of time or when they're walking for moderate distances, they can have more symptoms of pain in their back, numbness, tingling, sometimes weakness in their legs. And then when they sit or they lean forward, it actually gets better.
Okay, so Harriet, what were you feeling?
I was having pains down my legs as well as pains in my back.
So this had to be a debilitating situation for
Oh,
you.
it was. I was using a cane and
What does this kind of pain do to you, not only physically, but emotionally, mentally?
well, you can't do anything you want to do because you can't go walking like to Busch Gardens or to a fair.
Yeah.
I couldn't do any distance of walking at all.
You can't do any of your favorite things, and you
No.
want to stay active, right?
Right. And I was very sedentary.
Yeah, and that's not a good thing at all, doctor,
Not
is
at
it?
all.
Okay, so let's talk about treatment, because the go-to has been for some time now opioids, and we all know what kind of situation this country, this world is in right now with opioid prescription drugs. So what kind of treatment have you done for Harriet?
So I agree with everything that you said. In fact, it wasn't until 2015 where the CDC, Centers of Disease Control, released a whole bunch of data regarding the opioid crisis and how bad it is, the overuse, the addiction, and all the terrible pathways that patients end up following because of those things. So myself and my practice, we always use a comprehensive plan that's patient first, focused on what their symptoms are, what their complaints are, combine that with a physical exam, and try to come up with a comprehensive plan.
Okay, so what treatment did you do on Harriet to
So
make her
for
feel
Harriet
better?
specifically, she had already tried some conservative treatments. So we actually ended up doing a Superion spinal spacer, which is made by Vertiflex, and it's essentially a minimally invasive procedure that is not major surgery, that actually opens up the spinal canal and prevents endpoint extension. Okay, and why that's important is certain postures that you take when you're standing and when you're walking actually narrows down a pre-existing narrowing because of the stenosis further and causes symptoms. So what this does in essence is prevents that posture so that your symptoms are relieved.
Minimally invasive, I think that's really the key right there, right, Harriet?
Definitely.
How are you
definitely.
feeling now?
Wonderful. Wonderful.
Can you do all the things you used to do?
Yes, most of the time.
Yeah.
And the thing that drew me to that is that it wasn't an invasive surgery, and there was not the risk.
Right, yeah.
And
Well, the most important thing is that you're free of pain now and you're able to get up and move around.
Right.
Absolutely.
Wonderful. Great job, doctor.
Well, thank you.
And for more information on what we're talking about here, you can visit flsps.com or you can call 813-333-1353. Dr. Noman Azim and Harriet Patola, thank you so much to the both of you. Daytime will be right back after this.